Today's topic is blood in stool. What does it mean? Finding blood in the stool or subsequent to wiping might frighten you. There are numerous potential causes, and some are moderately harmless, some require treatment, and some might need immediate medical care. Rectal bleeding can be a side effect of many circumstances. Some can be serious, others not so much. It acts as a warning sign for an issue somewhere in your digestive tract throughout the alimentary canal that is from esophagus all the way down to anus and areas in between. The color of blood gives you some clue as to what's going on in there. As in, if the stool is black or tarry, the bleeding source is most likely to be in the upper gastrointestinal tract, esophagus, stomach, or duodenum. Whereas if it is bright red in color, it indicates the bleeding site to be in lower gastrointestinal tract, large intestine, rectum, or anus. What are the causes of blood in stool? There are some serious and some mild causes of blood in stool. Among them are, number 1, hemorrhoids, the most common cause of blood in the stool. These are swollen veins inside the anal region that usually lead to passing bright red color blood in stool, along with associated symptoms like pain and itching around the anus. Blood in stool also acts as an indicator of hemorrhoids in majority of cases. Number 2, anal ulcers or fissures. This is a common cause in infants. These are small tears in anal lining that lead to passing blood in stool with pain and itching. Patients may experience anal spasms or have a skin tag or lump. Number 3, inflammatory bowel disease, IBD. It is a broad term used to portray a few diseases of the colon, including autoimmune diseases like ulcerative colitis and Crohn's disease. In this condition, your body attacks itself by sending WBCs to the digestive tract that release certain chemicals causing inflammation in the region. Number 4, diverticula. These are little pockets that take birth inside the colon. They are predisposed to infection leading to inflammation and can break and bleed with the aggravation or sepsis. Number 5, colorectal cancer. It is a cancer of the colon or rectum in which they have non-cancerous growths in their lining. Number 6, certain medications like warfarin or apixaban can also lead to gastrointestinal bleeding. Number 7, bacterial or parasite infection is also a potential cause of rectal bleeding. Bacteria involved could be Salmonella, Shigella, E. coli, or Campylobacter. Entamoeba histolytica is a parasite that causes infection in the GI tract. 8. Other potential causes involve gastritis, proctitis, colitis, or constipation. How to look for the cause of blood in stool. Your health provider will first inquire about the color and quantity of blood in your stool. Some tests may be performed to make a better diagnosis. Complete blood count, CBC. Fecal occult blood test. A sample of stool is analyzed for the presence of blood. Nasogastric lavage. A tube is inserted into the stomach through the nose to remove the contents of the stomach. Barium X-ray. Barium is inserted into the rectum, or the patient is asked to swallow it to take a better look at the digestive tract on X-ray. Endoscopy. A tube with a camera is inserted in the GI tract to take a better look inside the gastrointestinal tract. How is bleeding in stool controlled? The best treatment methodology relies on the cause and origin of the bleeding inside the GI tract. On the off chance that blood outcomes from an ulcer, the disease or irritation, the specialist might provide some meds including antibiotics on treating H. pylori infection or anti-inflammatory medication so to deal with colitis. At times, surgical procedure is important to forestall further bleeding. The specialist might perform it using an endoscope or colonoscopy. The strategy might include removal of polyps and the damaged parts. The cauterization is then done with the help of electric current, laser, or heat probe, and sealing off the affected blood vessels with clips.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.